As you know, tobacco, alcohol, and drug use among adolescents has skyrocketed in the past few years. As a healthcare provider, you are one of the people on the front line.
Doing good. Nice to see you.
Hello, my name is Derrick Watkins. This video, using the Adolescent Drug and Alcohol Screening Instrument for Primary Care, ADASI PC, in healthcare settings, highlights the importance of screening for both risk factors and usage patterns of tobacco, alcohol, and drug use in adolescents. It also provides helpful tips for implementing the instrument, a computerized, self-administered tool within your medical practice. Now, this video will cover why screening for substance abuse and risk in adolescents is critical, how ADASI PC works, implementing ADASI PC in your practice, and the ADASI PC online course. Now, by the end of this program, you should have a good understanding of ADASI PC. Not only that, but implementing ADASI tells your patients, especially the parents, that you are concerned about what's happening to youth today and are taking a proactive stance. The importance of screening for substance abuse and risk in young patients cannot be overstated. Both the American Academy of Pediatrics and the American Medical Association advise to screen for substance abuse. Now, recent research indicates overall rates of drug use are almost twice as high among adolescents as they were in 1992. 25% of 12th graders and 12% of 8th graders report using an illicit drug in the past 30 days. And children are experimenting with illicit drugs and alcohol at a much younger age versus 30 years ago. The research also found that youngsters who do not use illegal drugs before the age of 18 are more likely to avoid drug problems. Research supported by the National Institute on Drug Abuse has noted many risk and protective factors for drug abuse. The family can be a protective factor or a risk factor. Children who do well in school tend to be less likely to use. Children with strong social skills and who are not shy tend to be less likely to use. Children in locations where there is more drug trafficking are more likely to use. Children involved with pro-social groups, such as school, community, sports, arts, or religious groups, tend to be less likely to use. And children who believe drug use is harmful tend to be less likely to use. Now, keep in mind that these are protective factors and are not perfect. Any child lacking at least one of these factors is at increased risk. Now, you may think that adolescents don't care about the opinion of clinicians, but research shows otherwise. Research suggests adolescents are interested, and reassuring them of their right to confidentiality can increase the chance of their self-disclosing information like this to almost 50%. While laws concerning confidentiality vary from state to state, there are some general guidelines that fit most cases. Check with your state board for more information. Now, once alone with the adolescent, explain that your conversations are confidential to the extent allowed by law, and that the law requires that only if you discover that the adolescent is in danger of hurting himself or herself or others does such a revelation need to be reported to the appropriate authorities. Consult with the adolescent about what you will discuss and what will remain confidential. Remember, the teen, not the parent, is your patient. Invite the parents back to the room at the conclusion of the visit to discuss your findings and any remaining issues. Both the adolescent and the parents should be offered a chance to ask questions. It is important that parents are aware of issues of confidentiality as well. Parents need to know that legally and ethically you are mandated to treat teenagers and keep the care confidential. Exceptions to this rule may exist if the adolescent's level of substance abuse is associated with injuries, legal entanglements, failure in school, deterioration of physical or mental health, or if the teen's life becomes in danger. In cases such as these, the physician is obligated to inform the parents or guardian. ADASI PC facilitates this process by allowing adolescents to take the test and get feedback. with the reassurance that if they don't want to disclose their answers to anyone, they don't have to. Once they finish the questions, ADASI gives them expertly tailored motivational messages designed to fit their specific risk behaviors and usage levels to help them to behave in a more healthy way. ADASI PC was created by Daniel International Incorporated to support regular substance abuse and risk screening and intervention in healthcare settings. ADASI PC helps adolescents identify and prioritize risk in a non-invasive and confidential manner that promotes provider involvement and intervention. The instrument was designed with the input of a panel of experts to ensure the questions reflected current research and were culturally sensitive. This screening tool is the first substance abuse and risk assessment designed to be patient-centered and adolescent-focused. Because the instrument is individualized based on respondents' answers to specific questions, it is appropriate for adolescents of all ages and risk levels. The instrument captures a variety of information specific to risk reduction. Computerized skip patterns allow for individualized assessment and provide targeted risk reduction messages specific to each respondent. Now, if adolescents choose to share their results, a provider summary sheet is generated to facilitate increased provider-patient discussions. ADASI PC also helps patients prioritize the risk issues they would like most to discuss with their healthcare provider. In this way, a patient-centered approach can be taken, helping providers to focus on the most relevant and realistic risk reduction strategies. Implementing the ADASI PC instrument into primary healthcare settings is a simple process with outstanding benefits. The incorporation of the instrument into your office routine is a non-invasive process, requiring only that patients have access to a computer and printer in a private space, such as an exam room or specially designed part of the waiting area. In order to make most efficient use of time, the ADASI PC should be administered prior to the physical exams while patients are in the waiting room. Upon completion of the screener, patients may or may not choose to print a summary sheet of their assessment responses to share. Interpreting the results produced from the screening is a straightforward process. The provider's summary sheet is laid out in a clear and simple fashion. However, depending upon your experience and training, determining which behaviors to address first may be daunting, and discussing your patient's substance abuse and risk may be difficult or awkward. You may also be challenged by strict time restraints with each patient. The ADASI PC is designed to overcome these barriers by initiating patient care and health awareness before you even enter the exam room. It can also help facilitate relationships with your patients, as well as your ability to give them the best and most comprehensive care possible. Depending on patient readiness to address substance abuse and related risk and influencing factors, the risk assessment can serve as a conversation starter for risk reduction. It can also serve as an indicator of additional physical and mental health problems. For those less familiar with counseling techniques or risk reduction strategies, there are provider guide sheets that accompany the ADASI PC instrument. When you receive a patient summary sheet, it will be coded with one or more icons. Each icon displayed represents a risk category and directs you to a matching guide sheet that provides specific counseling tips and risk reduction suggestions. Each guide sheet also includes phone numbers and email addresses that you can give your patients, as well as helpful resources for you to learn more. The scenes you're about to see demonstrate the implementation of the ADASI PC.
Hey. How are you?
I'm doing alright.
So this is the ADASI instrument. This is what we were talking about, the screening. Okay, now you can use the keyboard or the mouse to move through the instrument. And when you've answered each question, just click the next button to proceed to the next page of the assessment.
How did everything go? Fine. Okay. Your results were printed, and I wanted to know if you wanted to share it with a doctor or if you wanted to keep it for yourself.
Note that in this case, the patient does not want to share the results with her healthcare provider.
I'm not sure you had the opportunity to complete the ADASI PC while you were waiting to be seen, but it really is an excellent tool that can help patients identify their substance abuse and risks. That way you can begin to make changes to the behaviors that put you at risk in the first place. Tell me, have you ever been tested for substance abuse? Well, why don't we just take a minute to discuss what you know about substance abuse? Can you tell me what substance abuse is and what you know about addiction?
Substance abuse is when you're addicted, right?
Well, that depends on the drug. But substance abuse in general is using a drug in a way that harms us. But we can't always see the harm. Sometimes it's helpful to have someone, an expert, on the outside that can do special tests or just check in with us to be sure. Have you been thinking about doing something that may harm you?
Well, a few months ago, I was at this party. I was feeling really left out. Everybody else was drinking and having a great time. I felt really pressured.
I see from your ADASI PC summary sheet that you did not identify yourself as being at risk for substance abuse, and you have not been using any drugs or alcohol. You seem to be making good decisions about your health and safety. That's good.
I'm trying, though sometimes it's not always easy.
It's important that you continue to maintain your health and keep it a priority. Anytime you feel tempted, you need to just remember that's not what you wanted. No, you can always talk to somebody you trust. If you feel like you're in a situation where you may be tempted,
implementing the ADASI PC in your office can be done with minimal administrative and procedural changes. Issues of confidentiality and privacy will need to be addressed, yet can be handled quickly and effectively by educating staff to all new procedures, highlighting the importance of sensitivity especially. Here are some tips to help facilitate the process. Identify one person in your office, such as a nurse, reception staff person, or aide, who can coordinate all ADASI PC related activities. Brainstorm confidentiality issues that may arise with your staff ahead of time. Stress with all staff that the topic of substance abuse may make patients uneasy, and all staff need to be highly sensitive to this. Have the coordinator run through the ADASI PC instrument regularly, and keep this video available for staff to review. In addition to the development of the screening instrument and accompanying provider guide sheets, we have created a CME accredited online course for healthcare providers. This course is designed to enhance providers' level of comfort in and knowledge about conducting a brief substance abuse screening and intervention with their patients. The course covers topics such as the most recent counseling and testing techniques, current research regarding behavior change, and epidemiological trends pertaining to substance abuse. It is interactive and case-based. The online course may be used to fulfill necessary continuing education requirements. For more information about the online course, please visit the Danya website at www.danya.com. So, to recap, we know that 25% of 12th graders and 12% of 8th graders report using an illicit drug in the past 30 days. Adolescents who do not use illegal drugs before the age of 18 are more likely to avoid drug problems. Adolescents who understand their responses are confidential are much more likely to report substance abuse and related concerns. And adolescents are interested. They do want to talk to their doctor. And if they don't get help now, they are much more likely to have a lifetime of problems. ADASI PC, the Adolescent Drug and Alcohol Screening Instrument for Primary Care, is specifically designed to address those issues and screen for substance abuse and risk behaviors. Components of the ADASI PC intervention include this introductory video, the ADASI PC instrument, provider guide sheets, and an online course. Thank you for taking the time to learn about this needed screening tool. Please visit www.danya.com for more information.